This is my video for the physical assessment skill. Before I did anything, I would knock on the door, introduce myself, perform hand hygiene, provide for privacy, and explain the procedure. So we're going to be doing a physical assessment. Could you tell me your name and date of birth?
It's Matthew Jones, and November 5th, 1991.
Okay, and then I would confirm that with his armband. Do you know what date it is?
February 17th.
Okay, and you know where you are?
Yeah, the doctor's office.
Okay, and then who is the President of the United States?
Joseph Biden.
Okay, alrighty, and then I would get vitals. I would do his pulse, respirations, blood pressure, and temperature. And then I'll start the physical assessment, starting with the head. I'll don gloves. So this will be a head to toe physical assessment. First, I'm going to start by inspecting his hair, checking for any infestations or any alopecia, anything like that. Make sure everything looks normal, clean, not oily. And then I'll also palpate, make sure the head feels normal. There's no the skin is intact, no problems with that. And then I would also inspect his beard since he has a beard. Make sure there's no infestations there, any problems with that. Okay, and just check his overall color. Make sure he is pink, no jaundice or anything like that. And then check his ears. If I had a scope for the ears, I'd look and set that and make sure I don't see any abnormal discoloration or abnormal discharge or anything like that. And check the other side like that and make sure that looks normal. Okay, and then I'll check his eyes and make sure that his pupils are even. Check the whites of his eyes for any discoloration and the irises to make sure those are even and no discoloration there. And then if you could close one eye and then I'll cover that eye and I'm going to check his pupillary light reflex. Okay. Open your eye. Okay. And the other eye open. Okay, and so he has even pupillary light reflex, and inspect his nose, make sure he doesn't have any deviation of his septum, make sure that looks normal. Inspect his mouth, open your mouth, let me see that, make sure there's no cavities, make sure that looks normal, make sure his tonsils are there. If he has tonsils, make sure that's a normal color and it's nice and pink. Make sure it's moist, so not dry like he's dehydrated. And then